Today, there are 13,298 active cases of COVID-19 in the province. That's an increase of 968 cases on 14,833 tests for what we call a positivity rate of 6.4%. 871 Albertans are in hospital with COVID-19, 139 of whom are in intensive care. Sadly, 24 more Albertans have passed away from COVID-19, meaning that 1,217 Albertans have lost their lives to this disease since the pandemic began. On behalf of all Albertans, I extend my condolences to the families and the loved ones and each and every one of them. On November 24th of 2020, I announced that students in grades 7 through 12 would move to at-home learning on November 30th, 2020. This would be for 19 days prior to the Christmas break that started on December 18, and all students from grades K to 12 would spend 1 week learning at home until in-person classes were to resume on January 11th. That was the plan that we announced before Christmas, and today I am pleased to announce that we are sticking to that plan, and we can confirm that classes will resume as planned on Monday, January the 11th. The decision to resume in-class learning on January 11th is based on carefully considering the importance of attending school in person, as well as the latest evidence of cases dropping in all school-related age groups in December. And this is based on advice both from our Chief Medical Officer as well as the Minister and Department of Education. Schools play, of course, a key role in supporting student learning as well as their emotional health, mental health, and overall well-being. At the beginning of the school year, families across Alberta made the choice that was best for their kids and their family situation as to whether or not to have their children attend in-person class this year. While about 20% of families and students chose to learn at home, the majority of parents chose in-school learning. For younger children, learning at home can be often challenging from an academic, social, and emotional perspective, especially for parents who didn't make that choice. And it also often puts at disadvantage, in particular, kids from families living with perhaps lower incomes who don't have the easiest access to technology to keep their kids learning online. And we also know how important a classroom environment is where children can interact with teachers and with their peers. A long break from that environment can have serious impact on the mental and emotional health as well as the well-being of young people. For those families that chose in-class instruction, I want to thank all of you, as well as, of course, the teachers and supportive staff, the principals and others who adapted to this challenging situation and got through the week of at-home learning this week. I want to say a special thank you as well to our students and teachers in grades 7 to 12 who have been learning at home since November 30th and have done a great job despite the challenges. I know that some of you might feel anxious about putting your backpacks on and going back to class on Monday, but it's important to note that between September and the winter break, only 0.4% of students, that's 0.4%, less than 0.5% of students and school staff tested positive for COVID-19. Now, even though the vast majority of students and staff did not get the virus, many nonetheless face challenges and disruptions as a result. And I know some still have serious concerns about the coronavirus, and understandably so. But we have a practical plan that will always put the safety of students and school staff first. We'll make changes as necessary to ensure there is a safe learning environment during the pandemic. Dr. Hinshaw will speak to the safety of returning to in-person class shortly. And let me just say that to all of our teachers, principals, and other school staff, I thank you for all that you are doing to help get our students through this pandemic. However, while there is a reassuring trend in a drop in cases for all school age groups in December, following the most recent restrictions, COVID-19 does remain broadly spread across Alberta with few exceptions, with few local exceptions. Testing numbers did drop over the holidays. That was anticipated. But we saw a continued high positivity rate. And let me just pause there to put that in context, because I think maybe we got a bit used to high numbers in the past couple of months. But I remember from basically May through the end of September, a bad day would be a 2% positivity rate. And in the last week or so, we've been seeing about 7%. It's also important to underscore that even though we have seen the number of active cases drop pretty substantially since measures were introduced back in November, the reality is that we are ahead of most other Canadian provinces on a per capita basis for total active cases, new cases, and most sadly, COVID fatalities. So we need to understand we've made progress, but we are far from getting out of this. All of this suggests that we would have seen much higher case numbers over Christmas if the testing was at the same level as it had been prior to the holiday. And although we saw a peak in ICU and hospitalizations at 155 patients and 953 overall, our numbers for both metrics have not gone down significantly. We just clicked under 900 today. It's still far, far too high. And Alberta, in this respect, is not alone. Across the country, with the exception of the East Coast Atlantic bubble, all other provinces saw a significant increase in cases and hospitalizations in November. And while the active cases in provinces, Western Canada, I should say, are going down from their peaks, we still, as I say, do face high numbers. And active cases in Ontario and Quebec continue to go up, as in places all across the Northern Hemisphere around the world. In order to ensure that we take into account the very real possibility of an increase in cases as a result of the holidays, and given the fact that our case numbers, hospitalizations, and positivity rate for testing remains high, Alberta's current health measures will remain in effect for at least 2 more weeks. Let me pause to say that when we announced the current policies back in December, we said that we would review them in a month. We had a lengthy meeting of the COVID Cabinet Committee today to review this, the latest up-to-date data, and on things like hospitalizations, the rate of transmission, the positivity rate, and all of that. And we took the advice from our Chief Medical Officer. We need some time to see what impact, once the testing stabilizes post-Christmas, we need to see what impact the holidays had on testing. And, of course, we also need to prioritize reopening the schools as we are doing and begin to see what impact that may have, although we are confident it will not accelerate widespread social transmission. That has not been the case in the past. That means that all Albertans, businesses, organizations, and service providers must continue to follow existing health measures until at least January 21st.